Good afternoon, all. I'll start by saying we really appreciate you guys for having us today. It's our great honor to stand in front of all of you. I'm by name Sani Moise, and my colleague here is Brady. We are student physical therapist assistant from South University Tampa, and we'll be talking about thoracic outlet syndrome. I hope by now everybody has this piece of paper. This is just a summary, and we'll just cut to the right. What is thoracic outlet syndrome? Thoracic outlet comprises of three things, which is the thoracic outlet itself, the brachial plexus, and the subclavian artery and vein. The thoracic outlet region is a pathway between the neck.
What you can do? Attach that, okay.
The thoracic outlet is a region between the neck, which is the end part of the cranium, which is the head, to our shoulder region into the hands. And the brachial plexus are just nerve roots. What are nerve roots? Nerve roots are my latent fibers, which are pathways which send sensory motion from the peripheral nervous system to the central nervous system. Then we have the subclavian artery and vein. These are regions which helps in the venous circulation and the arterial circulation. What is thoracic outlet syndrome? Thoracic outlet syndrome is the compression of this subclavian artery, vein, or brachial plexus, which can be caused by what? Postural, bad posture, or the first rib and the clavicle. Types of thoracic outlet syndromes and symptoms. We have the neurogenic TOS, which is the most common. This comprises of pain, weakness, numbness, tingling in the hand, neck pain, and headache. Then we have the vascular thoracic outlet, which we have this venous insufficiency. The venous compression comprises of we have swelling, heat, tingling, pain, and everything like that. Why the arterial insufficiency comprises of coldness and everything. You feel the coldness in your fingers and your thumb. The picture over here is just showing us the region of the thoracic outlet syndrome where this compression happens.
Okay, my name is Brady. As Sonny said earlier, I'm a student physical therapist assistant at South University with him as well. Just going to kind of go over the different demographics and etiology of how these symptoms are presented. It's typically mostly found more commonly in women than men. Some things to think about with that is women with childbirth are always usually carrying the child or have something in their hand, so it puts a lot of pressure on the shoulder in places and positions that makes that little compartment there compromised to added stress. Young adults, 20 to 40 is the demographic, what they say is as far as most common. There's not a correlation between most of that. As you age and progress in life, you will get a little bit more kind of broken down, if you will, but the majority presents between 20 and 40, usually because it's just added stress from just daily life and just being more active. As Sonny said earlier, it's a compression of the spinal nerve root, so the nerve root that actually is coming off of the spinal cord itself is becoming impinged in the shoulder, up in that area. Also, if you tend to have a poor posture, so if you might sleep on one side more than the other, or you have some sort of traumatic injury to it, sports injury or a car crash or any sort of added stress to that, can cause that numbness and tingling, as he was saying, can come with heat or just loss of sensation that you're getting there in the shoulder. To move on from that, you also have the shoulder girdle itself, which can be compromised with a more acute blow to the shoulder area. If you are having these symptoms, which would be like disturbance of sleep, so if you wake up in the middle of the night, or if you're just hanging out and you just have the loss of sensation or tingling in your fingers, that could be a sign of the thoracic outlet. Also, any types of carrying below the shoulder, so any briefcases or book bags or strollers or whatever the case may be, can cause that to flare up. So you'd want to go and get that checked out. Computer desk. So again, that's just being in a position for a long period of time. Your muscles will become adapted to that position, therefore they can become tight. So you may get the same sensation when you break out of that posture and start moving again. You might get pain, in that area. Implementation of the treatment. So there's a few different things that you can do for stuff that you can do home remedies would just be just rest. Obviously, just want to give the body time to recover, and then ice within the first 24 to 48 hours, and then heat there on after. There's different stretches that we will go over here a little bit. Also, if you feel any tender areas, it's always good to work those out as well. It could just be a tight muscle. So without actually going and getting a doctor's, I guess, diagnosis of that, you're not really going to know you have it. But you can take things here and there and kind of help subside the pain while you do deal with that. And I believe he has a couple exercises we'll show you in a second.
In addition to what he just said, to make you guys understand very well what is going on in this place, it's just, let's think of us having a water line, and we're trying to fill the ending of the other side. So just imagine this water line is so flexible, and we step on it, what will happen? It's going to reduce the force of the water. So technically that's what is happening over here. So if that compression due to slouch posture, when we get old, we have slouch posture, sitting down for long, other stuff. So it causes compression on this. So same thing is going on over there. And for the venous insufficiency, let's just imagine the water line is so flexible. Once we step on it, what happens? It swells up. And if care is not taken, it bursts. So that's what is happening over here for the venous insufficiency, because the blood can't go back to the heart. So that's it. So over here now we'll show you guys just a little stretch, which Brady here will be my patient. The very first one we have scaling stretch. The scalings are deep muscles of the neck, which helps in side bending of the head from side to side. So my patient is here now, so I'll tell my patient. So I want you to bend your head to the side.
The side's affected, so this way.
Okay.
So side affected from the other side.
So I want you to put your hand behind your back. Okay. Give me a good body posture. Straighten your back. So bend your head to the side. Okay, sideways. Good. So he's going to hold it there for like 30 seconds, which is a standard of stretching. Four reps of 30. So that's what I want him to do. So he's going to do that. Then after that, he'll turn his head to the other side and do the same thing to stretch that muscle out. Secondly, we have the pectoral stretch, which is the chest muscles. So I'll just want him to come to this edge of the wall. So this is a home health exercise which you can do by yourself. You don't need a bunch to teach you. So I want my patient, so I want you to go in like this, keeping your foot together, good body posture, and you push into the wall. You hold that. So I just want you to assume there is a money behind your back. So I want you to push and squeeze into that money. Don't let me take it from you. So you do the same thing.
Wait, go ahead. People on this side cannot see you properly.
Okay, so we'll just use this place so you guys can see us better. So patient, I want you to go in. Yeah. So I want you to push in, keeping your foot together. So as you push in, I want you to imagine there's a money behind your back, or there's a bill. Don't let me take that bill. So I want you to push and squeeze the scapula together at the same time. Good. So he's going to hold that for 30 seconds, which is the standard of stretching. 4 reps of that we need. So the next one we have thoracic extension. For the thoracic extension, we'll actually need a chair. We'll sit on the chair, and my patient will put his hand behind his head and raise his hand up. And he's going to hold that for 30 seconds, 4 reps. So, and the last one, we have the wall, the arm stretch, arm extension or wall slide. So, patient, I want you to come over here, stand on your back, like this, keeping your head straight, keeping your back straight. And I want you to give me 20% of your core muscles. And at the same time, I want you to breathe. Don't hold your breathing, okay? So, gradually go up. Keep that hand on the wall. I want everything to be on the wall. Good. You want to have a good body posture as you do this. So it helps in relieving the pressure at the thoracic outlet over here. So that's it. And thank you very much. Any questions?
This is done how often? Or is this as you feel the pain, or every day?
I'll actually say for you to have a better diagnosis of this, so you better just go see your PT, or you walk into the hospital to see your doctor. Just don't assume you have a thoracic outlet syndrome, because the third thoracic outlet syndrome is non-distributed, so we never can tell what's really going on over there. So, but for this exercise, you can just do it anytime you want in the day, and just do it as long as it relieves your pain and it relieves your discomfort. So that is what we just do.
Do they use like an X-ray or MRI to do the diagnosis?
Yeah, once you go see your PT, we have some special tests we usually do as a PT or as a PTA. So once we do those, and if we cannot really, if we treat the patient for 2 weeks and the patient's condition is not improving, so we usually refer them to go see their practitioner doctor so they can do the MRI or something to let us know what actually is going on. Maybe it's a thoracic outlet syndrome or a venous insufficiency. Because if it's a venous insufficiency, exercise can help you. So you have to go in. They do a little bit of surgical operation to take away the first ribs, which is called rib resection. So they take away the first ribs to make that passage easy for the thoracic for the brachial plexus and the vein. Any other question? No question? Thank you very much, and we
Thank you.